Contraceptives can be broadly divided into two classes. Spacing methods, that is to delay the next childbirth, and terminal methods, when no more childbirth is required. Spacing methods can again be barrier methods, that is they prevent meeting of sperm with ovum, thereby preventing fertilization. Intrauterine devices, which can be non-medicated or medicated. Hormonal methods. Post-conception methods, that is if conception does occur, then terminating it at various periods of time after conception, like menstrual regulation, menstrual induction, using oral abortifacient, and medical termination of pregnancy. Miscellaneous like abstinence, coitus interruptus, safe period method. The natural family planning methods, basically they use the knowledge when does ovulation occur and not having coitus around that time. The basal body temperature method, cervical mucus method, and a combination of the two. Breastfeeding can also be a type of natural family planning method for the first 6 months or when the first period occurs, whichever is earlier. Terminal methods can be sterilization surgery for male or sterilization surgery for female. Barrier methods, condom, female condom, it's a polyurethane pouch to be worn by the female before the intercourse. Diaphragm, also known as Dutch cap, it's a vaginal barrier. It is to be inserted into the vagina and to be fitted over the cervical opening using the fingers like this. On the left side it is being inserted, on the right side the diaphragm is in place over the cervical opening. If a spermicidal jelly is filled into the diaphragm before insertion, it increases the contraceptive efficiency of the diaphragm. Spermicidal jelly and vaginal pessary containing spermicide agent. Intrauterine devices. Intrauterine contraceptive devices are again of two types, non-medicated or inert, also known as first generation intrauterine devices. These are no longer used. Medicated or bioactive intrauterine device can be of second generation or third generation. Second generation intrauterine devices, they contain copper and they release it over time. Third generation IUDs, they release hormones. Lippies loop was the first intrauterine device to be used. It is first generation, non-medicated, inert. Its mechanism of action is it induces local inflammation in the uterine cavity, thereby probably preventing the implantation of the zygote. Copper T and multi-load are copper containing intrauterine devices. Mechanism is the copper, which is slowly released, induces mild inflammation of the endometrium and thereby leading to incapacitation of the ovum. Also, it alters the biochemical composition of the cervical mucus and it inhibits the sperm motility as well. And thirdly, it changes the milieu of the endometrial lining. It is no more hospitable for implantation should fertilization occur. Copper T, multi-load. These are the things you must know about these. Hormone releasing IUD or third generation. Under the national program of the country, it is not used. It releases progestin locally and acts by thickening the cervical mucus and thinning the line of the uterus. Maybe it partially suppresses the ovulation as well, not known yet. Oral contraception means consuming the contraceptive orally in a form of pills. Can be hormonal. Hormonal can be combined hormonal contraceptives, that is which contain both estrogen and progesterone. Progestin only contraceptives, also known as progestin only pill or pop. An emergency contraceptive pill are also high dose progesterone only. Non-hormonal oral contraception contain centromin. Oral contraceptives Mala N, Mala D contain oral contraceptive pills. They contain both estrogen and progesterone. Then centromin containing tablets and progesterone only pills. What should you know about oral contraception, mechanism of action, and all these? Injectable contraceptives. These are hormonal but are injected into the body and they then remain there and slowly releasing the hormone, leading to contraception for some time. The mechanism of action is they inhibit the surge of LH, which inhibits ovulation. They also thicken the cervical mucus due to depletion of estrogen. Only progesterone is there. And these are the topics you should know about injectable contraceptives. Terminal methods of contraception include vasectomy in male and tubectomy or tubal ligation in female. Some facts about the terminal methods is in female sterilization, either laparoscopy or mini laparotomy are the two surgeries which can be performed. Male sterilization is known as vasectomy. If there is a choice between sterilizing a male or a female in a couple, vasectomy, especially non-scalpel vasectomy, is preferable over tubectomy because vasectomy is simpler, safer and cheaper compared to tubectomy, especially the non-scalpel vasectomy. And a candidate undergoing sterilization may be compensated if the surgery fails.